Somebody else? Okay. Yeah, this is, hi there. Thank you very much, by the way. It was all fantastic. I'm sure everybody appreciated it. For Dr. Gerber, I've got a question here. So you were talking about parasites, and I know from some of the information of Dr. Yu that oftentimes the sort of normal doses don't seem to be effective, he finds. So my question to you is, how do you determine your dosages and your prescriptions for the individuals, and do you find that you need to sort of over-prescribe more so than the normal to get the job done?
I think prayer is good. You can see if we turn up these mics a little bit in the back. I don't know. It's such a subjective deal. We use about 6 different drug things and 3 or 4 herbal things, and I know this. It's really. It embarks on the fanciful. Really does, but there's a lot of subjective way. It's subjective. Whenever you call a dose on something, it's going to be 7 days, 10 days, 2 weeks, 1 month, 2 years. It's always a subjective call that we're doing. And so I'm lucky. I'm doing EAV, electroacupuncture, so I can test. I can put stuff right on my plate and see, does albendazole test for this person? No. Does tinidazole test for this person? No. Does Alinea test for this person? Yes, no. And then you can be really, really out there. And this is out there. But you can ask a person subconscious, they want 3 days of Alinea, 5 days of Alinea, 2 weeks of albendazole, and that flies in the face of every scientific rationale you could ever want. But it comes down to that, really. And then you treat the person, you see them back in a month, and then we can immediately test on EAV to see if the parasites are still weakening the person. And if they are, and then you say, well, the albendazole still working? No. Well, let's go to tinidazole, the stromectol, the Alinea. It's mighty damn subjective. And again, your traditional send them in the hospital for an O&P is useless. Having markers done by some of the big labs around, and you'll send them in there and they say, parasites are found, but the name is unknown. So now that's a lot of help right there. And taxonomy unknown. So it's an art form, and I'm not sure how Dr. Yu goes about it. But doing serial stool testing is probably good. Some of it you can do antibody testing. But again, it's a serial process. I know Shirley Scott. You guys know Shirley Scott, Santa Fe, New Mexico. Old buddy for like 40 years. She's a parasitologist. And she gives multiple things at a time. She'll do 2, 3, 4 things at a time. And she thinks herbs are worthless, except for maybe amoeba, single-cell organisms. But for worms, she always does the herbs. And she treats on day 1, day 30, day 90, day 180, and sometimes 365. So she repeatedly hits them for the worms and the larvae that keep hatching out, especially if patients are obviously symptomatic. And she'll do a multiple drug regimen and repeat it and repeat it. Now, this has a lot of disadvantages. The number one is financial. And you can do, 5 days of Alinea commercially for, $800. You can do albendazole for 2 weeks commercially for $4,000. Now, your compounding pharmacy may be nice guys, like our compounding pharmacy in Henderson, Nevada, and they take the lactose out of albendazole and they do 2 weeks of it for $56. So it's nice to have a good compounder on your side when dealing with antiparasitical drugs. And it's an art form, no question about it. And you can use your intuition, the patient's feedback. You can do laboratory testing. But how do you know? How does anybody know what length of time? So we see a lot of strep pneumonia this year, and do you want to treat that with Biaxin, or you want to treat it with azithromycin? So we can test on our little machines, or you can do like chiropractors or the ART testing, as does Klinghardt, and asks, well, you want a test for 7 days? No. 10 days? No. 14 days? Strong. Now, man, it's subjective, but it beats just a clinical call out of the thin air. And there's no way to tell you how long to give an antibiotic or which antibiotic to use without doing a lot of culture techniques. And there are, sophisticated stuff you can do. So you can send off your cultures and say, okay, we'll see you in 2 weeks. And then maybe I'll have an idea for you at that time. So doing some kind of subjective testing. There's Dr. Omura's O-ring. I mean, it's a lot of weird stuff, but if you're into it and you get good at it, it helps you to hone your diagnoses and to hone your dosages. Thanks for the question. Can I have a question? Ask a question. I would like to. We got more out there. I'm sorry.
Go ahead.
Where do you get your lead scanning machine for the patellas?
There's only really probably 4 available in the country. One in Toronto, everywhere Dr. Howard Hugh goes. So they're not available for clinical evaluation, and it's very difficult to calibrate. So basically, that's a research tool that's not really available to a clinician.
Darn.
Jess, could you tell me, is the problem with nickel that it causes cellular disruption in most everyone, or is it the high percentage of people that react to nickel?
It is a surprise when someone does not react to nickel. Some of those reactions are weak, and you will have to watch very carefully in the cytoplasm of certain cells. If you're working from serum, you won't have that advantage, but it is an unusual day when it does not react.
I just had a quick announcement. Dr. Valerie Cantor had to leave, and if anybody has a question for the regenerative endo, her email, if you want, is askdrval@gmail.com, askdrval@gmail.com. Thanks. Thank you.
That's it? We're good? We're good. We go party here. What's our AGD?
Any other questions? Here we go.